If you suffer from anxiety, depression, cognitive fog, trauma, dry skin, inflammation, that puffy face, chronic pain, fibromyalgia, ringing in the ears, TMJ, poor posture alignment, if you have low energy, dry skin, insomnia, there's so many things that the powerhouse of the SCM and the vagus nerve connection with the fascia will release for you at home. I'm going to quickly show you a manual release, but of course, you know, I'm going to level it up with the tools that are going to make it feel so good and make it while you can do this daily and become a daily part of your healthcare. That's what healthcare is. It's your relationship with yourself. What do you do at home to take care of you? And that is what we're here changing this landscape to make it feasible that you can do these things in a few minutes within your day. Feels amazing with maximum benefits. So the SCM over here is this muscle running up and down the side of your neck. If you are able, most people tell me they don't like to do this, but you can try to pick it up and give it a shake and wiggle to release it. You're also going to want to release back in the occipital area where it connects and working into this area behind your temporal mandibular joint. But leave it to me, we're going to level this up. Now, there's a NeuroFlow set on the site that is directly for these issues going on right here. And so battery's running low in this vibrational set we'll put in, and this is going to be your first step. Obviously, you know, the vibration is going to go through the tissues to really loosen that up. That is what we want to accomplish first, and we're going to be able to pick up that SCM with ease. Look at this. Oh, yep, that feels as amazing as it looks. You're just going to do this a few times, or what feels good to your comfort. Now, you're going to want to do this to the other side, but for example purposes of this video, we're going to switch over to the bar. The bar here also battery operated energy bar, and we're going to release front and back of the ear. You're going to want to slow down when you're doing this, and we're going to come and we're just going to release over this tension here, and you're going to want to go underneath the jaw here and pull it down, and do the same, just kind of putting this up into the area of the occipital. You're going to have a lot of tension there, especially if you clench and grind those teeth, or if you are stuck in poor posture with forward head posture. And after that, we're going to want to come in. This is going to create the most calming and cool sensation. The heads on this are very different than any other roller that I have in the store, and these have a cooling sensation. It feels absolutely phenomenal, and you're just going to do the same things that you did. Whew, feels so good. And now we're getting that release, and within the minutes following, when you do this, you're going to see things start to drain out of your face. You can kind of see, I do this regularly, but just from that little bit, the little bit of lymph and fluid and inflammation that was down here is already draining out of my face. We're going to lightly roll this. We're not going to want to pull too much on the facial skin. That's why I have the feather when we're doing the face. There'll be a whole face program coming out for those of you who want it. This intention is to focus on the FCM muscle, and you're going to want to come and roll this out. You can do this with the vibrational roller too. And then same thing, we're going to pick up back here. You can see that picking that up. Yep, that does feel as good as it looks. And then the very end, we want to come in with the fascia spark. This is going to give a lot of stimulation that is going to feel good. You know, we're just going to roll it. See how we're just rolling it out? You could do this after the vibration set. It's totally okay. But we're really going to use this and the points in here, and I want you to push and pulse this into the occipital. Pulse 333 in order to release the attachment where into the occipital. Getting a little, feels so good that I'm getting distracted. So go ahead and read the full blog post, and then head on over to the store and pick up your set.